April 17th, 2020. Thanks for joining us. This is Janet Hale with the Rock Island County Health Department. Today we have with us Nita Ludwig, the administrator at Rock Island County, and Ed Rivers, the director of the Scott County Health Department. We do not have prepared statements for you, but we ask that you direct any questions that you may have, we do have prepared statements. We ask that you direct your questions at the end of the prepared statements in the chat box. As always, Brooke Barnes will moderate the questions. Nita, why don't you start us off with Rock Island's numbers, please?
Sure. So today, Rock Island County Health Department has 13 new COVID-19 reported cases. That does bring our total cases reported to 214. 12 of the patients are currently hospitalized. The rest of that are isolating at home at this time.
In Scott County, we have had 6 additional cases for a total of 155. We have a couple of things to address today. We've received many inquiries about wearing of face coverings in public, so we thought we'd give some guidelines on how to do it properly. First, you should focus on the fit. Covering should be snug but still comfortable. Cover your whole nose and mouth and extend under your chin. You should put it on carefully. One of the most important steps is to use appropriate hand hygiene. Before putting it on and after taking it off, wash your hands or use hand sanitizer. And don't touch the covering while you're wearing it. It's important to understand that the outside of the covering is considered to be contaminated. The virus can survive from 2 to 7 days on surfaces such as coverings, studies have shown. The Iowa Department of Public Health advises that you should avoid touching or adjusting your covering while in public, and clean your hands immediately if you do touch it. You should also take it off carefully. Be careful not to touch the front of the covering or your eyes, nose, or mouth while removing the covering. And of course, wash your hands or use hand sanitizer after removing the covering. Your hands could be contaminated with the virus from removing it. Wash the covering often. The Iowa Department of Public Health says you should launder the covering after each use and when it is visibly soiled. This will kill and remove any virus remaining on the covering. And you have to remember to maintain social distancing. Wearing a face covering is one of the additional steps we can all take, but it does not replace social distancing. Stay at least 6 feet away from others and avoid crowded places. The covering is not a complete protection from the virus. Also, we hope by now that you haven't been able to turn on the TV, open up the newspaper, turn on the radio, or open your social media feeds without hearing or reading our Stay Home, Save Lives message. Above all else, this is what will help protect us and our community. However, we do want to acknowledge the fact that there are many in our community who are still working or providing critical services to our community in this time. For the grocery store and restaurant workers, the healthcare and public health workers, child care workers, business employees, now is not a time when they can choose to work from home, do virtual work, or use other non-traditional options to stay home. They are relying on the rest of us to stay home to help minimize the risk to each of them as they make the trek to work every day to provide the goods and services that are keeping our family and community running. For some of our friends and neighbors, they simply cannot afford to stay home without putting the livelihood of themselves or their families at risk. For many, no work means no pay, and no pay turns into no food, no health care, and no housing. These members of our community bear a large portion of the burden of COVID-19's impact on our communities. Again, it is up to each of us to take the steps needed to keep ourselves and others from becoming infected and spreading the virus to those who must still fulfill their duties. If you're able to stay home and work from home at this time, great. Thanks for taking our advice. Please continue to do so and make sure that even though you might be getting antsy to get out and about, you only go out for the essentials when you need to do so. If you're still going into work each day, thank you for the role you play in our community. Make sure you're washing your hands often, sanitizing your workspace, and finding the best ways possible to distance yourself from others while you are at work. And once you're home from work, stay home. And again, go out only for essentials when they're absolutely needed. If you have elderly or homebound family or friends, make sure to check in on them and monitor what needs they have, but do so from afar. I'm sure your dad or grandpa would love nothing more than a visit from you, but even a short visit can turn deadly. A phone call, visit through the window, or a video phone call can help keep you connected and meet their needs. We each experience this pandemic, but we each experience it in unique ways. For those of you needing assistance during this difficult time, we encourage you to reach out. Visit the Together QC website for links to resources for individuals, families, and businesses. And remember, we're in this together.
Next, we'll hear from Nita Ludwig with the Rock Island County Health Department. Go ahead, Nita.
Thank you. For several weeks, you've heard us talk about how Illinois and Iowa might have differences in response to this crisis. One of these differences is how states report clusters of any infectious disease, including COVID-19. The Iowa Department of Public Health has been reporting outbreaks in specific workplaces, nursing homes, and in other businesses by name and location throughout the state in the interest of public health in these unique times. The Illinois Department of Public Health has not been releasing the same information. We at the Rock Island County Health Department must follow the rules and regulations sent out by the state of Illinois. We understand that this can be frustrating to the public, but Rock Island County Health Department will not specifically be naming workplaces, nursing homes, or other facilities. What we can report is that all of the work we do in our infectious disease section, environmental health staff, and management team are working with leaders of those facilities to mitigate issues and keep these communities as safe as possible.
Thank you, Nita. We're now going to go to the questions that have been submitted. We did have a couple of questions that were submitted ahead of time, so we'll just start with those. Nita, these somewhat relate to the things you were just discussing, so I'll give both you and Ed a chance to respond to those. We can start with Ed on some of these. We keep hearing rumors told to us of places where several people are sick. The health departments must be keeping track of locations of COVID positive cases. Are there any hot spots in the two counties? You want to start, Ed?
Sure. We know, and we've told you before, that COVID-19 is in our community, and the number of cases exceeds the positive result numbers for both of our counties. This is in large part due to the fact that those who contract COVID-19, more than 80% will become ill with mild to moderate symptoms, may not need a COVID-19 test, will be able to manage their symptoms, and may not seek health care. Each health department does a follow-up for each positive case. Questions are asked of the individual to determine where they may have been and who they may have been in contact with. Health department staff then follow up with any necessary locations, such as workplaces, where the individual may have been when they were symptomatic. Due to this process, staff are providing guidance to any and every business type entity that ends up with a positive case. Neither health department will name specific locations of positive cases to ensure privacy is upheld. In the interest of public health, the Iowa Department of Public Health has been releasing information on outbreaks that are occurring and impacting large numbers of people in the same location, and they will continue to take the lead on these decisions.
Nita, would you like to respond to that for Rock Island County?
Sure, that is very similar. We can state that we have had clusters in our county, and our environmental health staff and infectious disease staff have been working with leaders of those businesses or agencies or entities, and we have done the contact tracing of any positive cases to have them isolate appropriately. We have also identified any close contacts. We've been working with their leadership on signage and education, hand washing, social distancing, all those same things that we want all Quad Cityans to do.
And then as a follow-up to that, can you explain what qualifies as a hotspot? Ed?
Well, we don't use the term hotspot to discuss COVID-19. The word outbreak is what the Iowa Department of Public Health has been using in guidance that they're providing, and that's the proper term. An outbreak in a business involves the circumstances when greater than 10% of employees are ill with COVID-19 symptoms such as fever, cough, sore throat, difficulty breathing, or other respiratory symptoms. In a long-term care facility, an outbreak is defined as 3 or more positive cases in residents of the facility.
Nita, do you want to respond for Rock Island County?
Sure. We also use the term cluster, and a cluster is a group, just like Ed was explaining, of 3 or more cases that are in the same workplace or the same nursing home or the same congregate care facility.
One last question that was provided ahead of time. The Tyson plants cases in Columbus Junction affected 2 counties, Louisa and Muscatine. Is there cooperation with neighboring counties to the QC to coordinate any response? For instance, Tyson and Jocelyn could include residents from Rock Island, Henry, or Whiteside counties. Ed?
Well, in Iowa, when a business identifies that an outbreak of COVID-19 is occurring in their facility, they are asked to report the outbreak to the Iowa Department of Public Health. IDPH will then work with the local public health department to support and provide guidance to investigate cases and identify contacts. So the county in which the business exists coordinates the response. However, individuals with positive test results that reside in another county will receive follow-up in the county where they live. So while the larger response will be coordinated by the state and local health department where the facility exists, other local health departments also play a role.
Nita, would you like to answer for Rock Island County?
I would just echo that. That is exactly the same process for the Illinois side. And also that Scott County and Rock Island County, as you no doubt know by now, we work together very well too. Even though we're on opposite sides of the river, we do coordinate information and education to those types of facilities as well.
Okay, now we'll go to the chat box. Why more deaths on the job recently in Scott County? Ed?
We have had 3 deaths in Scott County, 2 in individuals older than 81, 1 between 61 and 80. That's the information that we can release on the deaths.
And to follow up to that, why more positive tests on the job recently in Scott County?
Same answer, but everyone mostly has a job, and it depends on your definition of a death on the job. Just because someone dies from COVID-19 does not mean it occurred on the job.
Nita, I believe the second one is for you. Why are there more positive tests in EM? I'm assuming that's East Moline.
I don't think there is a known answer to that question. They're scattered throughout the county. So, they're just, what we've been saying for the last several weeks is that it is community spread. So it's in every community within our counties, Scott and Rock Island. And that we just wanted to highlight, now is not the time to let up on the social distancing. Stay at home as much as you can. Wash your hands and practice all those good hygiene things that we've been saying for several weeks.
Thank you. In Illinois, Warren County is investigating 3 confirmed positive cases at the Smithfield plant in Monmouth. It looks like maybe that wasn't a question, but just a comment. And then the last one, are you able to dispel any rumors that the Tyson plant in Jocelyn has multiple positive cases and has become a cluster? Nita?
Again, I will not specifically identify any workplace, nursing home, congregate care at this time, but I will say if there are clusters in our county, our infectious disease staff and or our environmental health staff are working very closely with those places that have clusters.
Please type in any additional questions into the chat and we can answer those before we conclude here in just a moment. Could you address the differences between the health department's recommendations not to wear masks or face coverings compared to the new recommendations to wear one? I'm assuming this has to do with a timeline, how the recommendations have changed.
Yes, early on the guidance was that wearing masks in public was not protective against the virus. That advice still stands. We're talking about face coverings to help minimize the spread from those who might be infected with the disease. At base, the CDC changed its recommendation. So our talking points today were intended to provide guidance on how to properly wear a face covering. We say covering because we don't recommend wearing medical masks. We recommend you wear your own covering and save those masks for healthcare providers and emergency response people who need that commercial supply.
Okay. Where can the public get face coverings?
There are a lot of patterns out there from various sources on how to make your own. And you can go to Together QC to see some of them.
Okay, with no additional questions, we're going to conclude for today. Thank you all for joining us. Have a nice weekend, and we look forward to talking with you again next week. Thank you.
Thank you.